Well, it's time for our health report, and joining us now is Africa 54 health correspondent Linord Moudou to tell us about fake and counterfeit drugs. Linord?
Hello, Vincent. Hello, everyone. Well, criminals are raking in billions of dollars by selling counterfeit drugs, putting millions of lives at risk. A gathering organized recently by the United States Pharmacopeia Convention tried to address the problem.
The release of a new drug is a complex process, and quality control is an essential aspect of the process. Drugs must be deemed safe and effective before being marketed. A huge amount of counterfeit drugs is being sold around the world each day. Africa and Southeast Asia are among the areas most affected by the illicit business that poses a major public health risk for communities. Linord Moudou, Deputy Director with Nigeria's National Agency for Food and Drug Administration and Control, says the selling of illegal drugs is a major problem.
Counterfeiting is actually the greatest problem that we have. We have the porous border, the weak regulation. There's low capacity of the manufacturers. So it means there's a gap. And the counterfeiters take advantage of this gap to bring in fake and counterfeit products.
Moudou is attending the international training program organized by the United States Pharmacopeia Convention, USP. The training at USP's headquarters outside Washington, D.C. brings together representatives of 17 countries, including Russia, Mozambique, and Mexico. It is a week-long information exchange forum among medicines control authorities. Dr. Patrick Lukule is the Vice President of USP's Global Health Impact Programs and Program Director for the USAID-funded Promoting the Quality of Medicine PQM program.
The ITP program, otherwise known as the International Training Program, is really USP's opportunity to bring together representatives from various pharmacopoeias around the world, also representatives for various regulatory bodies and national quality control labs, to bring them to USP and get them to share with us what are the various activities that is ongoing in their countries, and also get to learn about USP.
In 2010, a study on the quality of antimalarials in African countries, collaboratively conducted between the World Health Organization and PQM, revealed that 44% of the samples collected in Senegal failed to meet quality standards. A 2013 report on the quality of uterotonics in Ghana, a medicine used to reduce postpartum hemorrhage and induce labor, found that over 90% of the samples tested failed either the test for the active ingredient or sterility, and only 3 of the 26 products tested were officially registered with the Ghana Food and Drug Authority, FDA. Hudu Mokhtari is the CEO of Ghana's FDA. He says the country has adopted very strict regulative measures to tackle the issue.
What we do is that we go to the market, we pick samples of products on the market, we test them in the lab. If we find them substandard, what we do immediately is to institute a recall of those products. Then we would organize a safe disposal of those medicines. We fine the people who brought those medicines into the country large sums of money, and what we do is to name and shame those people who are involved in the business.
A fake medicine is deliberately and fraudulently mislabeled to fool consumers. Substandard medicine may contain too much or too little of the active ingredient, may be contaminated, may be poorly packaged, or fail to meet quality standards in other ways. Awareness is just one step in stopping the sale of counterfeit drugs, a very complex problem that observers agree is difficult to monitor.
And that's our Africa Health Report for today. Back to you, Vincent.
Well, thanks a lot, Linord. Be sure to watch Linord Moudou's Health Reports every Tuesday and Thursday right here on Africa 54.